Hello, advanced class. We're going to insert a LMA Supreme into our unresponsive mannequin today. So David's going to help me hyperoxygenate the patient. We've measured numerous times inserting that OPA. So he's going to hyperoxygenate, and I am going to check my equipment. So this is a weight-based device. The sizes are 1 to 5. It's from a less than 5 kilogram patient all the way up to a 70 to 100 kilogram patient. This is a size 5 Supreme LMA. It has the weight and the amount of air that you can insert in here on each device, as well as on the package. It's nice to keep the package so that you can continually keep it cleaner than dropping it on the ground and all that. So when I'm checking it, it's nice to have it in the package. So I'm going to insert these 45 mils of air in, and check for leaks. Checking for leaks. It doesn't feel like it's leaking. So I'm going to deflate the cuff again. I'm going to lube it on the posterior side with a water-soluble lube. I'm going to keep the lube away from the airway holes. And once he's hyperoxygenated, we're going to be able to insert this. So hyperoxygenated, OPA's out, sniffing position, tongue jaw lift. We're going to insert it just like that. And insert my 45 mils of air. I'm going to listen to his gut, to his right lung, and his left lung. I'm going to use a secondary confirmation device. End-tidal is the best, end-tidal CO2. I'm going to use a color metric, so we're going to put that on in between the BVM and look for our color change. Yellow is yes, purple is poor. To secure the LMA, I have to use tape and not a Thomas tube tamer. So tape on the big old plastic part and tape it to his face, and that should be sufficient. We can put an OG tube down here to suction out his gut. On the package, it should tell you the size. If it doesn't, should have some part or something. This is a 14 French. All of the adult sizes are 14 French. And then I'm going to assess his SpO2, his end-tidal, continually assess his unresponsiveness, make sure he doesn't have a gag reflex. In order to hold any airway device a little bit more securely, sometimes we decide to put a proper size C-collar on just to help so that their head and neck doesn't move. We can do it on ET tubes, multi-lumen, single lumen, supraglottic airways. So this is just to help us not take out that tube accidentally. So we're going to put on a medical patient. We're going to go ahead and put on a C-collar just to help us keep that secure. All right, have fun practicing. Thanks.